to them. So I will let them take it away. Thank you.
Hi everyone, I'm Philip Johnson. I work as one of the spine doctors in Mobility Bone and Joint. I have an office in Andover and Salem. We also have an office in Haverhill as well. I'll give a little backstory of who I am, but I grew up in Andover, trained in New York and Pennsylvania, so it's nice kind of coming home. Just started here in October 2025, and it's been great. So I'm pretty busy and seeing a lot of patients, a lot of familiar faces, new faces. So feel free to interrupt me at any point during the talk. So it's just kind of a brief overview, like the most common causes of back pain and what to do about it. And I'll defer a lot to Neil as far as the physical therapy and home exercise program stuff. That's number one, and that's the best thing to prevent stuff like this from happening. Start here. So, like I said, grew up around Andover, great coming home. Went to Boston College. That's where I met my wife. We actually lived downtown in Cambridge, but I reverse commute. My parents still live in Andover, so I'm stuck late operating, sleep over there. So went to Albany for med school, and went a little further south near New York City to Westchester. Really busy trauma area. Actually gets more trauma than New York City. It's all those highways coming through. So, and then I went to UPenn last year for spine training specifically. Just a little bit about me. Kind of like you guys, active, like to go to the gym, do outdoor stuff, rock climbing, tennis, picked up the drums in med school, pretty much talent shows, that was fun. And then I'm a self-proclaimed foodie husband, I guess now. So it's my wife Tiffany, and this is what she's really good at. No, she hated it. He slides, but somehow stays skinny. So briefly, just top to bottom, I'm just going to kind of go over some simple anatomy and then kind of go over these four topics. So, the pulled back or strained back arthritis, lumbar stenosis, which is basically pinching of the nerves, and then a disc herniation. So I'm sure all of us in this room have suffered some form of that at some point, and if you haven't, you will. So, and then just kind of go over the causes, symptoms, and treatment. So. Just from a broad view, most back pain, back issues does not need surgery. I'll kind of get into non-surgical and surgical options. The good thing is there's a lot of different options: medication, injections, physical therapy, and worst case scenario depending on the circumstances. Bad news is some people do need surgery, and that's kind of what I'm here for. And there's a lot of stuff online that may or may not be the best sort of information. I think it is probably getting better with like ChatGPT and stuff. So I think like one patient a day comes in at that, starts arguing with me why this, and I'm not a robot. And I think part of it too is like I kind of like this stuff, but us standing up in our curved back and a lower back, I think it's probably has something to do with why everyone gets back pain at some point, why it wears out, kind of where that curve is when you stood up. So this is a really busy slide, and I expect all of you to memorize it by the end of this lecture. But basically, the take home from this is that there's so many different muscles and tendons and attachments in the back that can be a pain generator. Even here on the right, where the glutes insert here, the obliques insert kind of in the back area. Your traps go all the way down your back and up to your skull, so it's all kind of related. And then this is just kind of, especially the one on the right, I really like just a model of like what's actually going in deep inside the spine. So these right here, you can actually feel on your back. So this is the stuff you can feel on your back. Spinal cord's kind of protected in the middle, and these are discs, the bones, and then the nerves that go out to your legs or arms. This is just kind of on the. Is there a clicker? Yeah, okay. Yeah, I don't think the mouse is showing up here, so I'll just. So myofascial strain, kind of a mouthful word, but that's the pulled back or lumbar strain. There's a lot of different words for it. By far the most common cause of back pain. And if you look at the picture at the bottom left, there's a normal tissue, and then you can kind of get some tearing or stretching or inflammation, and then eventually it heals. But every time you pull your back or something goes wrong, there's a little bit of scar tissue and wear and tear over time. A lot of truck drivers and manual laborers, this is happening a lot. Common risk factors, causes, there's going to be a lot of overlap, but really heavy lifting. The most pressure you can put on your back is doing something like a deadlift, unfortunately, it's a great exercise, but tight hamstrings. Some people have a really high pelvic tilt, which can kind of cause imbalances in the spine. Posture, even stress can cause some. So as far as symptoms, back pain, obviously, soreness, pain with activity, better rest. Everyone's probably looking at sometimes you have tenderness that's, but it's a lot of pain with activity. And, the question is, what do you do about it? Sometimes if it's really bad, a short course of rest, maybe a week or two at most. And then, Neil will echo this, that it's most important to kind of ease back into things. Don't just sit around for a month or 2 months. Just get worse, it'll tighten up. At the same time, when people come to see me, I obviously prescribe physical therapy, and then medications. I don't hand out medications like candy. It's really an adjunct to the therapy and the home exercise program. That's really the number one. But there's muscle relaxers if you feel like your back's spasming. Anti-inflammatories, you all know, they're great. You just got to watch out for side effects, affect blood pressure, and you get stomach ulcers at worst. Everyone might not be so familiar with that. Something to watch out for. And then there's steroids. Steroids long term, very dangerous, but it's usually like a short course of steroids. And then third line, this picture here, none of that's working, and you have like a very focal tenderness point. So not the most common thing, but our pain management specialists do trigger point injections. We're kind of putting steroid right under the muscle. You can point to one spot, like this really hurts. If it's kind of broad, I wouldn't recommend a trigger point, but that's kind of special scenarios. Yeah.
You kind of glossed over chiropractor.
Oh, yeah.
Or cupping and dry needling.
I was going to defer a little more to Neil on that. I don't know. I know dry needling is becoming more and more popular. I would say, in my opinion, it's there's no downside to it. I think it's a good adjunct to the physical therapy. Some people come in and say, "Can I just go to the chiropractor? Can I just do cupping?" I'm on. No, you're going to do think both, or just the therapy exercise. Kind of the way I approach it, but people get good results with those. So back arthritis, another very common cause of back pain. Typically in people in their 40s or older. So you can get arthritis in many different places. You can see in that top right area, you can get it in the disc on the left side, kind of wear out, and then also there's little tiny joints. We have a ton of them in our back. So, and usually if you're going to have one, you're going to have the other. That's almost like a vicious cycle. The disc wears out, which puts more stress on the joint, and vice versa. So, really, it's just wearing out a cartilage, same type of stuff going on in the knee and your shoulder. The cartilage wears out, and eventually it's going on bone, painful. And this picture in the middle is just a cat scan, kind of looking down your back. You can see on the left is a normal joint, nice clear line. And you can see on the right, kind of roughened up bone spurs. When those bone spurs get really big, the nerve is right next to it, and that can push on your nerve and give you a sciatica, stuff like that. As far as risk factors, kind of similar stuff. Just we're all going to get it at some point. It depends on if you get lucky, and if you have pain or not. Some people I see horrible X-rays, CAT scans, MRIs, and no pain, and vice versa. Pristine MRI, horrible pain. So it's my job is to match up the imaging and symptoms. Let's see here. So these symptoms of back arthritis a little bit different. It's like a lot of stiffness, soreness in the morning. Actually can get better with activity as the day goes on. Usually it's pain that's not in the middle of your back, but just off to the side where those joints are. May or may not be tender there. And again, if those joints get really, really enlarged, push on the nerve, and then that can give you the sciatica. So you can see here in this photo, just bone spurs there, kind of a disc arthritis, and then let's say up here, not much arthritis in the joints, but here you can see it's all white, fluffy. Those are just the bone spurs we saw. So, back arthritis. Again, first line treatment, getting a dead horse, but physical therapy, staying active, trying to stay thin, go to Cedardale. Yoga, Pilates, that's good for really any back at all. But I say that just as like a maintenance thing, that balance and stretching. I see a lot of people that just do heavy lifting and that's it. I think balance. stay in limber as well. Then medication wise, with arthritis, it's more of a long-term thing. So you have to think of like what's safe to take long-term. Tylenol, super safe. I know not everyone thinks it works, but I think it's good if you can alternate it with anti-inflammatories. And a lot of people like Celebrex, Aleve, Mobic or meloxicam. So they're kind of adjuncts. Take I recommend taking them on a bad day if you're gonna have an 8-hour drive or play 18 holes of golf. Take it before. But taking them every day, twice a day, no matter what, that's when you can sometimes get side effects. Aware of. And then third line injections, so you can actually, our pain management specialist can actually go in and target those joints specifically. And they can do 1, they can do 2, 3. Can't really inject the disc for the disc arthritis. Those little joints in the back is an option. And I'd say in general, injections are great. Some people can get relief for over a year. I'd say most people it's in weeks to months range. But the idea is to kind of bring it down to a level where you can do more stretching, more strengthening, more therapy. And surgery alone for arthritis isn't really a thing. I took these kind of non-smoking signs. There's some weird stuff I see on the internet, like the set fusion or, joint fusion in the back, these small little devices that can put in. It's a little bit of a red herring if you talk to a surgeon who wants to do that. Really, it's back surgery is better for when you see a nerve pinch because of something, whether it's a disc or a joint, which I'll get into in a little bit. The lumbar stenosis, fancy word for, again, nerve pinching. And again, can be from, look on the bottom right here, disc, like a disc bulge or herniation, the arthritis that we talked about. There's also a ligament in our spine that can kind of thicken. It thickens because your arthritis kind of makes things a little unstable and the body's kind of stabilize it. But at the same time, it can kind of pinch nerve, get sciatica, or pinch a nerve in your neck, have stuff going down the arm. And again, it's sort of a unavoidable thing. The question is, are you going to get symptoms or not? If you take an MRI over anyone over a certain age, there's going to be stenosis, arthritis, whatnot. But again, keeping the weight down, trying to don't smoke, staying active can kind of slow the process, so to speak. So stenosis can have a little bit of a different picture, you can have the arthritis picture. Sometimes I get something called claudication, where you're walking a long time and you feel like your legs are cramping, or the pain is so bad you have to sit and stop. So that's kind of a little more something I push patients towards surgery kind of faster than usual, because when you have that and then you stop moving, and then it's kind of a snowball effect. And this is called the shopping cart sign, and we learned this first year in med school. It's you get relief bending forward because those holes where the back, those holes where the nerve open up when you lean forward actually get bigger, so you get relief. When you lean back, it actually hurts. So that shopping cart sign is actually, you can diagnose someone with stenosis if you actually see that at the supermarket. So, and then sometimes if it's pushing so bad, you can get, weakness or foot drops, stuff like that, and that's when it gets scary. But that's pretty rare. Treatment, again, same type of thing. Guys, probably my job at this point, but first line always physical therapy, home exercise program, medications. I threw in this. I talked about anti-inflammatories, Tylenol, gabapentin or Lyrica. I don't know if you've heard of that. It's kind of a nerve medication. It's really good at symptoms going down the arms or the legs specifically. Not really good for back pain. The one side effect of that, it can make you a little bit drowsy, so people usually start taking it at night, see how they do. And that is another alternative. Injections, so they can target those levels. This is actually what Dr. Palma, Dr. Morigi, the pain management specialist, is what they're doing under X-ray. They make sure the level's right. And then you can see right here, that's actually the steroid going in the back there. And then if all else fails, or if you have like a foot drop, really bad weakness, that's when I would, recommend surgery. You're miserable, nothing's working. And typically for something like lumbar stenosis, it's a laminectomy surgery, pretty black and white. The nerve has pressure on it. You lift off the roof of bone above it, and you get rid of the pressure. Did one of those this morning. The nice thing is, if you do a 1 or 2 level procedure, you go home the same day, you're up and walking. Really the only thing you can't do is bending, twisting, lifting for a couple of weeks because you don't want to end back up in the same spot where you started. But typically, the leg pain, that buttock pain gets better pretty quickly. It's funny, spine surgery is better at taking care of leg pain, butt pain, arm pain, generally speaking, than back pain. So it's kind of the art of medicine, so to speak. So this is the last topic I'll go over before comes up here. So disc herniation, I'm sure someone's had it, or someone's who've had it. I think of it, I know it's kind of gross, but it's like a jelly donut. There's some soft stuff in the middle. There's kind of an outer protective ring, and when there's a tear in that outer protective ring, and there's an event that you fall or you lift something really heavy, then that jelly kind of squirts out. This is kind of a model here that pushes on the nerve, and then you get really bad sciatica. So, this is when someone comes in the office and they're limping, they can't walk. It happens almost every week. I see something like this. Doesn't mean you necessarily need surgery right off the bat. It's just usually very kind of acute, severe onset. It's a very common in 30-year-olds, 40-year-olds, 50-year-olds. You're doing a lot of heavy lifting, if you're heavy yourself. Unfortunately, a lot of people, if they get one, they have more than one question. Okay. And then a lot of it too is, not just if you work at Amazon or something, but proper lifting mechanics is really key going forward, preventing that, keeping your back straight, squatting down. You can all do a better job there. Again, symptoms with this is really bad back pain that's kind of shooting down the leg, sciatica typically. And usually people complain more of the leg pain than the back pain itself, because that nerve's all angry and inflamed. That's a test I do in the office, straight leg raise test. Because again, it's kind of mimicking, the most pressure you can put on the disc is kind of bending forward or lifting your leg forward. This is just an MRI, and it's kind of tough to see. So this is a normal one on top. Spinal cord's the white circle in the middle, and then this one here, spinal cord's kind of this white, and this whole thing should not be disc herniation. So, the good thing is a lot of people can get away without surgery. The body can absorb it. Really, the only time I operate on something like this is, again, if nothing's working or you have like a foot drop or foot weakness that you don't want to become permanent. As far as the surgery for it, pretty black and white. You take out the disc that's pushing on the nerve. To get there, you have to shave a little bit of the bone. The nice thing is the incision's really small, 1 inch or less. Similar to that other surgery, you're up and walking that same day, go home. And that's actually what it looks like in the operating room. Get out.
What is that you're taking out?
Yeah, that's actually, the herniated disc. Yeah, so as people ask, you don't go in and scrape out all the healthy discs. It's really just the disc that's pushed out and a little bit, past it to make sure doesn't happen again. But if you've had one, it's about 30% of people get another one, fortunately. It can be
And then I imagine you're in a compromised position after that because you're missing that much cushioning that wasn't there.
Yeah, that's the problem. It's a slippery slope. You've lost that disc from the herniation. Surgery, you take out a little more. It's a balance. You don't want to take too much, take too little. But that level. I had someone come in. She was 18. Had the biggest disc herniation I've ever seen. You have to be honest. This probably won't be your last surgery, just because you're gonna have so much wear and tear over the next 40, 50 years. Yeah, that's the tough thing, but. On my end, so yeah, that was us in Turkey last year. Turkey. My dad and I love hiking and stuff. Mount Washington. There you go. So, yeah.
Could you speak up a little bit? My husband's a little hard of hearing and I'm having trouble.
Oh, sorry. Yeah, I know.
Project.
I mumble.
No.
Yeah, no, I mean, that's it as far as topics. I'm just going over the pictures. This was us in Turkey. my wife and I, and then, we were in Mountain, Washington with my dad, a couple of years ago, so, yeah. Happy to answer any questions now or later, yeah.
Yeah, what do you think about ablation, like a nerve ablation?
Yeah, no, that's something I forgot to include it. That's a good point. So that's typically good for the joint arthritis or the set arthritis. So usually they start with injections, and if the injection are working, but it's not lasting very long, it's almost like a test to get an ablation. So that's kind of, if you get good relief, even if it's for like a day, that's an option.
And then what's the next step after that?
Yeah, it's a good question. Again, it depends if there's pinching or stenosis, you can do a procedure or surgery. If there's not, in my opinion, that's kind of the end of the road, kind of dealing with it. Or, a lot of times it's like you got to go back and think, is it another joint or is it something else we missed? So, yeah.
The surgery you mentioned, is that also good for anterior polycystitis?
Oh, and anterolisthesis, or yeah, there's that, or spondylolisthesis. Yeah, that's a mouthful. So that's when like a slip disc, or when the joints in the back are very unstable and shifting. So with that, it's like you have to determine, is it stable, is it not stable? If it's stable, you can just do a decompression. If the surgeon determines that it's unstable, that's when you gotta get like a fusion.
And I herniated this because the spondylolisthesis or
Probably, I don't think it directly caused it, but it can kind of snowball and start it.
Does jumping at a elder ages, jumping, like jump roping, jumping, does that
Oh, yeah.
affect is that good for your disc or not good?
I mean,
You don't have any arthritis yet.
I think jump roping, it's good, that's what it does for, to kind of dissipate that stress. Yeah, I think it's different from jumping, like, I don't know, I'd like to defer to you a little more. On that.
Yeah, I agree. I think in jump roping, if you were doing a lot of like loaded, decelerated like box jumps, like jumping off
Right,
the
yeah.
heights and things
Yeah.
like that, that puts a lot more strain and stress on.
Sure,
But
yeah.
some of the light jumps,
Yeah.
sometimes that's good. Again, provided you have a health back to start with. It's so individual. It's hard to generalize everyone.
I just didn't know if over time and because mostly everyone as they age will get arthritis like that, right? So I didn't know if that would affect the disc if they were,
Right. Yeah, it's a good point. I think the box jumping. So
Yeah, that's probably
jump
why.
roping is pretty low.
What was that last procedure you showed? Was that the one where they go into your vertebrae and kill the nerves inside the vertebrae?
The last one I showed, that was like a microdiscectomy, take out.
What is that?
Yes, that's if you have a disc herniation. It's micro, 'cause I use a microscope, and then it's, instead of taking off that whole roof of bone like that first procedure, you're shaving a little bit on one side, because it's almost always on one side, and taking it out. So yeah, but one of the goals of surgery too is like preventing disasters in the future. So you don't want to destabilize the spine and take too much. It's always a balance of take too much, take too little. It's a sweet spot. Yeah.
I have scoliosis, and I don't think it was ever picked up.
Oh, right.
Yeah.
Yeah.
And I don't think that it actually entered my consciousness probably maybe
Yeah.
a year or two ago.
Gotcha.
And it's very bothersome. I try to do as much as I can.
Yeah.
I'm going to check out physical therapy location, locally that specialized scoliosis.
Oh, perfect. Yeah. Yeah, because a lot of it is that just causes an imbalance and it puts stressors on, one side more than the other. So you kind of get accelerated arthritis in some areas and decelerated. So it's a tough thing.
You're on my side.
Yeah.
Yeah.
Right. It's true. Good on you.
So my doctor was telling me there's a procedure that, because I've tried ablation several times, it's not
Yeah.
working. He said there's a procedure they can drill into the vertebrae and kill the nerves in the vertebrae.
Oh, yeah.
Are you familiar with that?
Intercept. Yeah. It's called intercept. Yeah, I personally don't do it, but they kind of take a needle and kind of go all the way in. Yeah, it's for really worn out discs.
Does it work?
Basically, I've heard good things about it. I haven't done my research on it. Yeah, I think it's a very safe procedure. It's kind of burning the sensory nerves in the bone that go to the disc. It's kind of like indirect, similar idea.
Intercept?
Intracept, yeah. Yeah, I think it's a kind of a narrow indication range, like you can't have too little, can't have too much. So I think if there's like, you kind of grade disc degeneration on a scale of 1 to 4, and I think if it's like a 2 or a 3, you can do that procedure, and then I think it works pretty well. I think, yeah.
Are there any chiropractors in the area that you'd recommend to focus on spine? I used to have one in,
Yeah, I
his
mean,
name, he was really good.
yeah, I wish I did, yeah, I don't, fortunately, sorry.
So I'm gonna do hopefully a good job complimenting Dr. Johnson's talk. My name is Neil Washington. I'm a physical therapist, work with Northeast Rehab. Part of the company that's downstairs. If you guys have been to our clinic downstairs, we're kind of all over. And so the two main questions I wanted to try to answer tonight that I get all the time, especially related to back pain, is what to expect if you go to therapy, and then how do you prevent it in the first place, which Dr. Johnson's already touched on. So now we'll kind of dive just a little bit deeper into that so you guys can see specifically what we do. And low back pain in particular is the single biggest or highest percentage of the diagnosis that we see in physical therapy by far. We don't see anything more than low back pain. It's what we see the most of. So no surprise, this is a perfect talk for everybody. And as we've already said, almost everybody in their lifetime will have some episode of low back pain. Has anybody not had an episode of low back pain? I'm curious. I want to like, no, never? Okay. Most people at some point, if you ask them, it may not be long-term or chronic, but even just a couple days or a couple weeks of an episode, it's very, very common. So we're going to go over patient education, exercise and core stabilization. These are basically the 5 main things that we would do for someone with low back pain. Manual interventions, meaning some hands-on work. It could be soft tissue work. It could be more joint related, stretching and posture. Other, we'll kind of mention a few things in between, but those top 5, and actually in that order of importance, education being the most important thing. So we'll touch on each one. Again, if you have questions as we go, feel free. But this is the treatment part. So if you've already seen Dr. Johnson or one of his colleagues, or we probably get about a 50-50 people that come into our office that have either already seen a specialist or someone who has not yet seen a specialist. So we get a variety. So sometimes we help to kind of figure out what's going on. Sometimes they come and we know exactly what's going on. So it just depends on where you are in that spectrum. So patient education is, in our opinion, in therapy, the most important thing that we can offer as therapists. And as has already been mentioned, having a painful low back experience or episode does not always equal serious injury. You can have a lot of pain, and it doesn't mean that you have anything catastrophic going on in your back. Sometimes it can, but most low back pain, as Dr. Johnson already mentioned, will get better with conservative care. Most people do not need injections or surgery. So the good news is your prognosis is pretty good if you have an episode of low back pain. So don't panic. The biggest mistake some people make is that they completely shut down all activities when they get episodes of low back pain. And they'll spend, as Dr. Johnson mentioned, sometimes weeks of doing nothing or laying in bed and just resting. A little bit of rest might be helpful. Too much of that is actually going to potentially make your symptoms worse or make other symptoms worse down the road as you're trying to recover from an episode like that. So what we usually recommend is as soon as you can, try to resume your regular routine. So you guys are all members here. We would encourage you to continue to stay active. Go to the gym if you can. Do the things that don't bother you. If certain exercises or activities bother you, obviously don't do those or modify them for a little while. Talk to one of the staff here. They might be able to make a recommendation for things you can do in the interim. But try to focus on the activities that you can do versus just the pain. And those activities will usually help help the healing process as you're going. So a lot of people just shut down and then they come to see us a couple weeks later and they're worse. And they're like, I don't know why it's worse. And I say, I know exactly why you're worse, because you've done nothing for the last 3 weeks. And now all your muscles have turned to mush because you've been laying in bed for 3 weeks. And now you have other issues going on in your spine. So we try to encourage activity, again, with modifications as necessary, but don't just become a couch potato for a month. I think it's going to help. So the second major piece, which kind of goes with this, is exercise, or specifically when we're talking about low back pain, we tend to focus on core stabilization. And a lot of times people think core is like just your abdominal muscles, and it's not. It's, yes, some of your abdominal muscles, your hips, both sides, into your lower back, and even up through like your shoulders and mid-back area. All these muscles and that core stabilization type of exercise actually protects your spine. They help give you stability in and around all those different joints that we saw in the picture earlier. It improves your postural strength. So most people have that posture, not because they want to, but because they don't have the strength in their muscles to stay upright for long periods of time. It's tired. So if you can build up some of the strength in those muscles, build up the endurance in some of those muscles, you'll find it easier to sit upright or stand upright. So exercise is important. It improves mobility too. So if you do exercise, it tends to improve how much your spine will move in a healthy way. And sometimes, depending upon the diagnosis, and we'll touch on which ones in a couple minutes, but sometimes we give you exercises that are very specific directionally because of what you have going on in your back. So if you had a disc herniation, for example, we would give you specific exercises to help try to get that material to sort of go back in, because like Dr. Johnson said, even for a disc herniation, and I've heard people say, I have disc herniation, I need surgery. You might, but you might not. So we can give you things to see if we can help correct that without surgery sometimes first. It's not always successful, but sometimes it can be. And this is like, what do we focus on for exercise? This is a classic presentation of someone, even without lower back pain. Because again, not everyone that has lower back pain has a bad looking MRI. I mean, I have no back pain today, but I can promise you if you took an MRI of my spine right now, you would find all kinds of things wrong with it. But it's not causing me any pain right now. So, but this is a classic presentation for anyone, specifically somebody who has lower back pain. And they typically have weakness in both their abdominals and their glutes. So that's that one line. And they typically have tightness in their hip flexors and their back extensors. And you can imagine a lot of people, especially in today's day and age, are tight in their hip flexors because we sit a lot. So our hip flexors are short all the time if we sit a lot. People who do a lot of moving around for activity or for work sometimes have a little bit less of that, but that's a classic presentation where we have tightness in two areas, weakness in two other areas, and they work together in a bad way to create sometimes low back pain that we have. So that's an area that we'll focus on therapy traditionally. These are just some examples. You can go very simple, you can go very basic, and you can go very advanced. And the nice thing about when you work on core exercises, you don't often need a lot of fancy equipment. A lot of it's just teaching you how to engage certain muscles, how to activate certain muscles, how to strengthen certain ones where you're weak, or stretch out certain ones where you're tight. So these are just a couple examples. There's nothing, special about any one of these, but you can see sometimes we use a ball for creating more instability, or a foam roller. We can have you take 1 foot or a foot and an arm, off the ground just to create more of that balance challenge. So lots of different ways we can strengthen your core. Again, without any fancy equipment, it's really just all about positioning.
I have a few questions.
Sure, of course.
So you showed some pictures of different kinds of exercises. So I don't have any back pain right at the moment. I have some lower back pain because I don't have good muscles back there.
Yep.
I've also just had a knee replacement
Ah,
operation.
okay.
But are there core exercises that, as an old lady, I should be doing on, a more regular basis
Yeah.
to make sure I don't have these kind of imbalances? Is there a sheet of paper or a place you could look something up? I looked them up online, but
I know, and like Dr. Johnson said, I'm a little leery sometimes of what you can find online. I do think there's simple things out there. I purposely don't bring handouts to an event like this because it is so individualized. I'd almost say, ask your primary doctor first if you have one, or if you have like a spine doctor you've seen in the past, maybe ask them. Or again, you can ask, you can sign up for even just like one visit for physical therapy. They can give you just a home program to work on. but making sure it's specific to what you need to work on. Like you said, you had a knee replacement, you've got some weakness in certain areas. You don't want to just give a general program. I probably want to give you specific things. to
I
work
am
on.
going to therapy, I will ask.
Okay, yeah. So just ask. That's perfect. Yep. So again, the next thing we like to do in therapy, typically, depending upon what you have going on, is manual interventions, which is really just using our hands. The first thing Dr. Johnson talked about was the muscle strain. If this is your problem, this is what we're going to mostly do, is because we're going to work on those tissues that have given you some issues. After you strain a muscle, as it starts to heal, sometimes it heals with some sort of like fibrous tissue, tight tissue. We want to make sure that as you're healing, those tissues line up the way they're supposed to and don't give you tightness ongoing or long term. So we'll do a lot of different sort of just manual work there, right on the soft tissue. The dry needling is one of those others that we do that, again, if you have tight tissue, can be very helpful and effective in this area. If you have more of that arthritic type condition, we'll do more work on joint mobilization and range of motion. We can still do some soft tissue mobilization or some soft tissue work, but it's not as effective because that's not the problem. The problem's in the joints. If you have tight tissue around those joints, we can work on that to help you feel better, but it's not a fix. It's just a temporary, it's like taking a Tylenol. It's going to feel a little better, but that's probably going to come back. So you really want to make sure we're addressing the underlying cause of your pain with arthritis, which is at the joint. Stenosis is, again, very similar. And again, as Dr. Johnson pointed out, the treatments are very similar for like an arthritis versus stenosis. Definitely more joint mobilization and range of motion. And again, this is where if you have pain with a certain position because it starts to push on a nerve or put pressure on a nerve, that's when we'll teach you sort of how to avoid certain motions, how to work on others. But again, it's usually a degenerative type condition. So it's not a fix, but we can try to get you to feel better. And usually as you add stability to your spine, you'll end up with less symptoms. And then the disc herniation is usually, the more serious of these different conditions. Sometimes it can be helped. This is where sometimes that manipulation becomes necessary. So somebody asked about a chiropractor. That's where I actually think chiropractors can be very helpful because they're better trained at some of what they call the high velocity thrust manipulations. And those can be helpful sometimes at helping some of that material, or if there's a joint that's sort of out of place a little bit, at putting that back in. Some physical therapists do that. Some don't. So you just have to kind of see if that's something that your therapist does provide. And depending upon where that disc is coming out, sometimes it's straight out back, sometimes it can be a little off to the side. Certain positions of how we do our work will help you or not as much. So it's a little bit more specific when it comes to like a disc herniation or a bulging disc or something along that line. And then stretching. So stretching is very important. And this is more of a long-term solution. So a lot of people come in very tight. A lot of the muscles in our hips and our thighs go up and attach to our pelvis and into our lower back. So that's why it's important to maintain a healthy flexibility, not just in your lower back, but again, hips, even chest and shoulders, obviously your back as well. But it's important for the long-term sustainability of pain relief to make sure that you're pretty flexible. The other big difference is the whole static versus dynamic. If you go back 20 years, 25 years, more than that. I mean, I can remember as a kid going to baseball games. I'm from New York, so I used to go to a lot of Met games. We try to get down close to the field, before the games to see the players. And they'd all be sitting on the field. And you probably remember this. They'd be sitting on the field, stretching, reaching, doing all that stuff. High school sports, everyone would sit in a circle and stretch, and they'd be sitting, on the ground. You go to any event now, it's more about dynamic flexibility, activating your muscles, warming your muscles up. There's very little static stretching anymore. Static stretching can be helpful. I do some as a therapist. I do static stretching with some of my patients that have very specifically tight muscles, or they need to be stretched statically a certain way to try to elongate some of those muscles. But I encourage most of my patients to try to be a little bit more active in their stretching, not just sitting and stretching. But if you're warming up to, let's say, even just to walk on the treadmill, or you're warming up to play tennis, or you're warming up to play pickleball or swim, you want to try to activate some of those muscles before you start to do that workout. It's going to make the muscles have more blood flow and be stretched out. So if you just stretch a cold muscle, it's not going to really work as well as if you do more active warm up. So that's sort of the old way to stretch a hip flexor on the left. And this is sort of the new way to stretch a hip flexor on the right. So it's still stretching the same muscle, but this young lady on the right is doing more of that active lunge walk to sort of, not just stretch out the muscles, but also to kind of activate some of the other muscles around it, get some blood flow to the area. So just as an example. And then there's all different types of stretches, and this is where I could spend an hour just talking about all the different types of stretches you can do. You can do some lying down, you can do some hands and knees, you can do for hip flexor, on a table versus a mat stretching. So there's a lot of different things you can do for stretching. These are just a few examples of them. These are not like the 4 most important stretches in the world. Just wanted to show you that you can stretch the same muscle multiple different ways. And that's an example of that. And then the last thing that we primarily focus on is posture. So proper sitting posture in particular, because again, in today's day and age, with everyone being on computers and laptops and tablets and our phones, we typically sit a lot. People at work tend to sit a lot. And they all have these fancy chairs like this one. I looked it up just out of curiosity. I tried to find the most expensive chair I could find, like on Amazon. And I got as high as $1,500 for a chair like this. $1,500. And you know what? They work. I swear to God, they work. However, nobody sits in them the right way. So they all sit on the very front edge of it, and they all sit like this, and they're in this $1,500 chair. And if they sat back in it where the curve was pushing into your spine and your arms were rested and your feet were on the ground and all that stuff, it would work great. But they spend $1,500 and they sit on the front edge of it, and it does absolutely nothing for them. So a good chair can be helpful if you use it. So we usually encourage people to sit back in their chair. We can, I'll show you a picture in a second that shows you the exact setup. But have somebody check you out. If you're gonna invest in something like this, and it can be very helpful. We want to maintain that slight curve in your lower back, even when you're sitting. You don't want to sit with a flat back or a rounded back. We want to have a little curve back there. That's healthy. That's a normal position for our spine. You want to have your feet flat on the floor, so your legs are taking a little bit of that pressure of your body. Your ankle joints, your knee joints can help absorb a little bit of that pressure. And then we'll talk about the rule of 90 degrees and screen position as well. But we don't want to sit like this. This is how everybody sits, right? You're all hunched over. I mean, these are kids, like I swear, go out to eat on a Friday or Saturday night, and people sitting at their tables are all on their devices. It's crazy. But so don't sit like this. Sit like this. Okay, this is the ideal position, especially for someone at a computer station. A lot of people working remote, virtual these days, so working from home. This is the proper setup, ideally. Very few people actually sit like this, but you can see the rule of 90s, as I mentioned earlier. 90 degrees, 90 degrees, 90 degrees, even at the elbow, 90 degrees. So that's the rule of 90s that we like to encourage people to follow. You can see the back is up against the backrest of the chair. So the chair is actually supporting this gentleman. He doesn't have one of those big fancy ones, but it doesn't matter because the position's good. Screen is right in front, so at eye level. So these would be ideal situation for sitting posture, whether it's at work in an office or at home, or even just, sitting on your laptop at night. This is what we like to see. I think this was mentioned once a little bit earlier by Dr. Johnson. We talked about the different pressures that can be put on the spine. And I was having a conversation with somebody before we came in, and they said, geez, I feel better when I stand, and I feel a little worse when I sit. I feel like it starts to get worse. Well, again, sitting has more pressure on our spine than standing. And most people think, well, I'll just sit down, that'll make it feel better. But actually, it creates a little bit more pressure on our spine when we sit, because we don't have our ankles and our knees and our hips to kind of help with shock absorption when we sit. And then if you load that position, or you bend forward, like Dr. Johnson said, when we kind of load or flex the spine, it puts even more pressure on. And then if you add some weights, even more pressure. So the best thing to do, temporary, not long-term, would be to lie flat to really unload the spine. But for people that sit too long and then wonder why their back still hurts when they sit, it's because there's a lot of added pressure on their spine sitting versus standing. So I always encourage people that are even working at home or in an office, set a timer for every 20, 30 minutes and just take a quick 2-minute walk, either around your office, walk out to the water cooler, try to get off your butt and on your feet and just move a little bit, which will help with the spine. So that's the treatment to expect. Before we get into prevention, I will just say, there's a lot of people that say, I've had that ultrasound before. It feels really nice. How about that stim that seemed to help last time? I would caution you, as general word of caution is, your therapist should really be hands-on with you. They should be teaching you how to move. They should be teaching you how to exercise, how to stretch. They should be putting their hands on you to find tight tissues and work that out. Those other things can make you feel okay temporarily, but they're not a fix. They're not a good treatment long-term. They might give you a little bit of temporary relief, kind of like taking a Tylenol, but it's not going to be a lasting relief. So I definitely encourage, a lot of direct one-on-one time with people when you work with them, whether it's a chiropractor, PT, acupuncturist, you want to be one-on-one with those folks. All right, so the other big question is, how do I prevent this from the first place? Stay limber, number one. If you stretch, you'll prevent obviously soft tissue muscle tightness, but also segmental tightness in the joints and the spine as well. So if you stay loose, do some regular stretching, that will help. These are the key players, the key muscles we usually recommend if people are getting into a good stretching routine. So you asked about like general stretches, or that was more exercise, but these are the general stretches we usually encourage people to stretch out regularly. Again, it can be people sometimes say, well, I have a hard time getting up off the floor if I get down on the floor to stretch, and then I'm afraid I'm not gonna be able to do that. You can stretch in a chair. These are just simple chair exercises and stretches that you can do. You don't have to have, again, fancy contraptions. You don't have to be on the floor. Even the bottom middle one here, that's a great piriformis stretch that you're doing sitting right in a chair. It's a tough muscle to stretch, but that position works outstanding. So, you can stretch your hamstrings, you can stretch your lower back, even hip flexors and sort of abdominals, chest wall, all that stuff can be stretched just sitting in a chair. You can get fancier. You can do things on the floor. Again, depending upon what your specific condition is, we might teach you differently. But if we're talking just about prevention, these are all great things to do on a regular basis. Again, I don't bring handouts because I don't know everyone's individual situation, and I don't want to generally prescribe something that could hurt you, depending upon if you have something going on. So talk to your doctor, talk to your therapist. And again, more often than not, if we can stand or move when we stretch, that's better. Muscle activation is definitely the way to go. So a couple other sort of flexibility tips. Again, minimize any prolonged static position. So sitting, obviously, we don't want to do for too long. But even if you stand, I think about people that work in a grocery store, they give them those mats which cushion their standing a little bit, but they stand still for a long time. That's also not good. Over time, that pressure kind of loads on our spine, and it can increase the pressure. So you got to move around. So try to minimize any prolonged static positions. Take breaks, and that could be more of a moving break more than anything. Most people think of breaks as like a sitting or resting break, but I actually encourage moving breaks more than the other way around. Get up in reverse posture, meaning if you've been sitting flex for a while, get up and extend. If you have been standing for a while, try to move, because then you'll actually get more flexion, which is good. So again, think about just constantly trying to reverse posture throughout the day, and drink water. Your joints and your muscles are going to be healthier if you're well hydrated. If you're dehydrated, sometimes it's easier to strain a muscle. There's a little less sometimes joint spaces. I mean, the discs are, you'll know off the top of your head, the percentage of discs, the percentage of water, it's like 90% water in our discs. So if we're not hydrated, your discs can actually shrink. So again, and I think, only because this just came up, I think people that have gone like astronauts in space, they come back and they have shrunk. Because the disc material and the joint spaces are so much less. Part of that's because of lack of gravity, but a lot of it's because of dehydration as well. So hydration is very, very important. Specifically the core stave exercise like we talked about. So I just want to touch on this one more time. You want to train your movers to move and your stabilizers to stabilize. The stabilizers to stabilize. So what do we mean by that? So on the left is your similar picture to what Dr. Johnson showed earlier. Tons and tons of muscle, right? Dozens of muscles in our back, upper, middle, and lower back. Notice how small some of them are, right? They're no thicker than a pencil, okay? They all work together largely to stabilize around our spine. You don't want a muscle this thick trying to do a heavy lift of a 40-pound bag of dog food or pellets, because it's not built to do that. It's not built to move. These thick guys are. These are our glutes, our hip flexors, our hamstrings, our quads. These are big, thick, strong muscles. So these are meant to move us. Those are meant to stabilize us. So when you exercise, you want to train that way. So when you're talking about strengthening your movers, we want to strengthen our glutes and our quads and our hamstrings by doing motions that strengthen them. When we strengthen our core, we want to work on teaching those muscles to stabilize us. And a lot of times things like a plank, and this is just one example, there's a bunch of different ways you can strengthen your core. It doesn't have to be a plank. But that's just one example of ways to engage all those small muscles to work together to give us better core stability. And again, when you're on your elbows like that, any sort of weight bearing through your arms engages your shoulders and your shoulder blades and some of your mid and upper back muscles. So it's not just that lower part, it's the whole core right up through our shoulders. And then Dr. Johnson mentioned this, proper lifting technique is very, very important. Probably the worst, and again, it doesn't have to be heavy. Heavy's worse, but it doesn't have to be heavy. Probably the worst case I ever saw for lower back pain. I was surprised that he was able to even walk into the clinic, but he hobbled into the clinic. He was a young, healthy, active man, law enforcement, very big guy, works out all the time. He was getting out of the shower, went to pick up a sock, and boom, he all of a sudden couldn't move after that. He had pain shooting down his leg, probably some sort of a disc herniation. So it doesn't have to be just because, you're weak. I mean, this guy was anything but weak. He was a very active individual. But again, he just reached down the wrong way, right? He didn't use good lifting technique even for something light, like picking up a sock off the floor. So use your legs. Keep the item close to you. If you can, if it's heavy, don't carry big things out here. Carry it close to you. Keep your head up. So again, this is a poor example of poor lifting technique. And this is an example of good lifting technique. So again, really engaging. And if you notice in this picture, I always like to point this out. The back position almost never changes. It's flat. It's pretty flat. A little bit of a hook here because the arms are out, but pretty flat, flat, and flat. So again, in this picture, this individual is using his core muscles to help stabilize and help maintain good position and letting his hips do all the work. The other question that comes up fairly frequently is, how should I sleep? My back hurts. What's the best mattress for me? Is it soft? Is it firm? There's no one right answer for everyone for a couple of different reasons. Your spine is different. You may be dealing with different type of condition than somebody else. Your preferred sleeping position also matters. This picture shows someone on their side, but you might be a back sleeper. You might be a stomach sleeper. So it's going to depend on you. But the goal for everyone is to try to maintain a neutral spine. What do we mean by that? So alignment, head right through your spine to your tailbone. So if your mattress is too soft and you're a side sleeper, your mid and lower back kind of sink down. So your head's higher, your pelvis is a little bit higher, and your back is in between. And you can see where that dip could potentially cause pain. If it's too firm or your pillow is not the right height, same thing, your shoulders could be higher. Now, a firm mattress for somebody who sleeps on their back might be fine. It also may depend a little bit on the pillow position or how thick the pillow is. And again, if you have big shoulders or you're a bigger body mass versus smaller, so there's a lot of factors that go in, but I just wanted to bring this up because people ask this all the time. And the goal is neutral spine. So again, the factors, pillows, firmness, and position, and even body type too. All right. So just a couple of key take-home points, and then we'll open it up for more questions. Again, most of the time, low back pain does not equal serious injury, so please try to stay active and don't just kind of shut everything down for weeks. Work on your posture and body mechanics. That can usually prevent a lot of injuries in the first place. Whether you're doing prevention or therapy, flexibility, core strength, and hydration are all really important. Try to avoid prolonged sitting. Again, I think most people don't realize that that's one of the positions that creates the most amount of pressure through our spine. So try to avoid that if you can. And then see your doctor or PT for specific recommendations because everyone is different. So we don't want to make something worse for you. All right. And that's my group.
Nice.